Hi, my name is Chris Mashburn. I'm Chief Operating Officer for Jorie Healthcare Partners. I've spent over 2 decades working across healthcare, security, and biotech, leading startups, navigating crisis management, and building operational systems from the ground up. As AI continues to reshape healthcare, I want to share 3 ways that I feel like it's very important that we include AI across the entire operational spectrum. First is optimizing administrative workflows. Let's start with what most people don't see: the administrative engine behind healthcare. It's massive, first and foremost. But before AI, teams were buried in manual data entry, approvals, paperwork, approvals again of the paperwork that was already administered. Now we're seeing AI streamline everything from building to compliance tracking. And we all know how important compliance tracking is in healthcare. What this also does is it reduces human error, speeds up the process, and frees up staff to really focus on the actual patient care and not paperwork. We know that that's ultimately going to lead to better outcomes for patients and also better revenue drivers for the healthcare systems. At Jorie, we've implemented AI tools that auto-code charts, they flag anomalies, they help process claims, process denials, predict bottlenecks, and even see those bottlenecks coming before they ever actually happen. It's really how you think about it is AI is the foresight of what we can't see currently in the manual process. And that gives what I believe leadership needs to have a massive edge going forward. The second item I'd like to talk about is supporting compliance and crisis management. We all know that in healthcare, there's compliance is key and kind of at the forefront of our operations, but we also see crisis management happens almost daily in healthcare. With my background in law enforcement and emergency management, I can tell you compliance and crisis readiness were boxes that had to be checked. The survival skills that I've actually learned in law enforcement that I brought over into the AI piece of healthcare plays a critical role here, especially when we see real-time alerts, regulations tracking, and even simulations that happen on a daily basis. We can now run and predict models in the operational risk aspect that spot vulnerabilities before they even escalate. That keeps compliance at the very forefront and keeps operational readiness there at the forefront as well as laws change and compliance changes, and even becomes more critical across all of our teams. The result is we create a safer, faster, more accountable healthcare system for all of us in that environment. Number 3, and the last one I'd like to point out here, is building scalable solutions, specifically with our Jorie Healthcare solution. At Jorie Healthcare, we've built a platform that merges AI, operational strategy, and compliance know-how to help organizations scale efficiently. Once again, keeping compliance at the forefront. This isn't just a theory, it's what we're doing every day, partnering with systems and providers who need to cut costs without cutting quality or compromising anything that relates to the strategy of compliance. Our solution brings clarity to complex operations, uses AI where it actually matters, and helps teams execute with confidence. From staffing challenges to really resource allocations across the board, we provide leaders with what they need: control, visibility, and impact for a better healthcare solution. AI is no longer just the future of healthcare. It is actually what's happening today and takes place in the real operational aspects of day-to-day operations. If you're a healthcare leader looking to streamline, secure, and scale, let's talk about that. So remember, I'm Chris Mashburn, COO of Jorie Healthcare. You can reach me through my LinkedIn connection, or you can go and visit Jorie's website at www.joriehealthcare.com. Look forward to talking and answering any questions. Feel free to reach out.